I wanted to join the dental discussion and have kind of an outsider's perspective on the dental population, in recognizing how much of an underserved population they are. So I'm not talking about their patients or clients. I'm talking about the professionals themselves. So all these professionals, they bend over backwards, they do everything they can, they contort their bodies, they work with a lot of patients a day to really help out, um, with their patients. But my question is, who takes care of them? So hi, my name is Henry Saldana. I'm a physical therapist, co-owner of Saldana Physical Therapy and Wellness in Tempe, Arizona. And this is my passion, this is my road that I'm traveling down to really help out these professionals. What I really wanted to do in my life was to heal people, help people take care of themselves, educate people, so they could have less pain and better quality of life. And quick little story, when I was in the clinic, for many, many years, I would always say, oh man, my neck hurts, my back hurts. We need some help to help out the professionals. So you would raise it up with your boss, and they're like, okay, this isn't profitable, this isn't worth our time, kind of thing. And I would make suggestions. Hey, if we set aside time, maybe help each other out 30 minutes a week or something with our pains and aches. And that didn't go over very well. So this is why I'm down that road. I want to be the guy that helps out these professionals who are in pain, these professionals, and including myself as a physical therapist. I never complained. I did what I had to do, and then I dealt with it after the fact. So I treated patients, did my notes, documentation on the computer, and then come weekend time, it was recovery time. It was time to work on my neck, my back, and a lot of people didn't really want to help while in that profession. So this is my goal, to help out that. So what I wanted to talk about, who are the dental professionals? So all the specialties, I'm going to list just a few of them out, but there's more. So we have our regular general dentist, you have your orthodontist, you have your periodontist, endodontist, oral surgeons, and I'm also talking about the dental hygienists, the dental assistants, and I would like to extend this to the receptionists and office managers. So I'm talking about all of you right now. You are all a flourishing and a dynamic team that really helps out with the experience and the patient's approach to getting this vulnerable care that they need. So it's oh so vital. Oral hygiene is so correlated with your overall health. So if I can help them help take care of other people, oh man, that's a dream of mine. So what I want to talk about, so I wanted to do discussions. One thing that I want to talk about is, specifically speaking to you dental professionals, do you have pain in the clinic? If so, what type of pain do you have? Where do you have it? How long are you having this pain for? And is it affecting your work? Uh, I know from dealing with, I'm a musculoskeletal expert, so I deal with people and I work with people all the time who are in pain. It it not only affects your job, but it affects your mood, your emotions, all that stuff. So we're not the same people that we are when we have this pain or dealing with it, yet alone if it's been a few weeks, a few months, or a few years, or a few decades. So that can really compound. So this is me wanting to try and say, I care about you and I want to know more about your pain and see if I can help you help yourself with it. So, where do you think that pain is coming from? Is it a lack of exercise? Is it your posture? How much education do you get in ergonomics? Or do your colleagues help you out with your posture? Like, oh my gosh, Dr. Jones, your posture is just terrible. I bet you have a bad headaches at the end of the day. We're not here to pick each other apart, but if we can somehow help each other out, that's what I'm all about promoting. Have a buddy system at work, no judgment whatsoever. That would really help. Also, another question, if it is posture, how much time and how much money are you willing to spend on ergonomic instruments? It could be a nice saddle seat for you with a nice swivel, nice comfortable cushion on there? Could it be a thicker instrument so there's less pressure when you use your instruments? Is it pillows, headrests, something to help the patient stay comfortable while you move them? Uh, do you bat an eye on how much you spend on that? Now, the same question goes, would you bat an eye with how much you spend on yourself? Do you do things to yourself or pay for things to help out with that pain? Do you get massages? Do you go to the chiropractor? Do you go to a physical therapist? Do you go to a wellness place and do cold plunges and saunas? I'm not saying any of those are better or worse than the other, but how do you prioritize your health? That's my biggest question. And that's what I want to create awareness about. So I want to have that discussion and try and show you over time that you and your health are the most valuable asset to your practice, to yourself, to your family. It's not just about work. Everything that we do at home could also take that route as well from where you're at work. So we'll just say if you're in a lot of pain, your patient load, your productivity is going down, you're making more mistakes. Well, what about at home? Are you doing the same thing? Are you short with your spouse? Do you not make time for your kids? Are you just trying to survive when you're at home because of this mind numbing and disabling pain? Or it could just be nagging at the back of your head and you might not notice it. It might not affect you. Um, my hope is to try and create awareness about it and show you how to help yourself with that. So, some other things that I want to ask, are there any other aspects that might have to? One thing that I want to talk about, and I should have put this at the beginning, was the prevalence of pain. So, it wasn't surprising, but it was surprising how many dental professionals are experiencing pain. So I'm going to take these quotes from Bethany Valachi. She's the veteran physical therapist and dental, we'll just say, ergonomic expert in this field. She has a wonderful program for dentists because her husband is a dentist, and she does research on how to help uh, dental professionals with pain. So according to her research, research suggests that the prevalence of musculoskeletal disorders in dentistry ranges from 64 to 93%. That's almost everybody. So, everybody in your clinic, do you know that they have pain? Are you aware of it? Have they told you? Or are they trying to hide it from you? Are they reclusing? Is their behavior, is their mood different when it's later in the day and fatigue might be setting, their pain might be getting higher? So that's huge numbers. We need to get those down. Uh, it shouldn't be just a part of my job or your job or their job. It's one of those things where we want to recognize it and see, is there something we could do about this? Are you doomed to having pain like this while you work? Well, I don't want to believe that that's the case. I don't want pain. My job is very, hands heavy. I have to move, I have to lift, twist, and all that. uh, I can keep my pain around a 1 or a 2 out of 10. And that's really good for me. I don't want it at a 4, 5, 6, 7 out of 10 pain that really affects how my body moves, affects how my mind functions, all that stuff. Because once the pain gets high enough, you can't even think straight. You need quiet. You don't want people talking to you. You get short tempered. That's just how it is with pain. So I want to create more awareness of the prevalence of that. Even more mind-boggling statistic: 15% of dentists left clinical work or cut their hours because of this pain. So I mean, it might not seem like a whole lot, but that's a number I don't want closer than 1 or 2%. Um, what are the most common pains that we're having? So the dental professionals report higher back and neck pain, as well as the dental hygienist, based on what their job description is, they might be struggling with more hand, wrist, or grip um, issues going on. So every job has a slightly different demand on you, and I want to make sure, okay, I'm analyzing your work duties, your jobs that you're supposed to be doing, and seeing if I can help you create a little bit of resiliency with this so your pain levels aren't skyrocketing. Okay, so a little bit about what happens when people come to me is I'll ask questions. So, do you have pain? Do you work with pain? Where is it? Describe the pain for me so I can kind of get down close to where it's coming from. Is it something that I can help out with the muscle and bones? And secondly, what are your thoughts on pain? Now, this might be kind of shocking to you. Okay, why is he asking? Is that even relevant? Well, yeah, it's very relevant. And that's one of the first things that I might do is address these issues. And is it something you have to deal with, or is it something that you don't complain about very much? Do you consider pain like actual tissue damage? Do you feel like it's more of like in your head and that you can control it with a good mentality? Um, and then, of course, like I said before, do you feel like this is just part of your job, that you're doomed to this pain while you work and for the rest of your career? Is it avoidable? Is it non avoidable kind of thing? And number three, if you have pain, what are you doing about it? Uh, and I can get all sorts of different answers, but unfortunately, as a society, we want a more passive and quick approach uh, to pain relief and to a lot of things in life. And unfortunately, that is just not the case. Pain takes a long time to develop, to turn into um, muscle or different type of tissue dysfunctions. It's going to take time to try and reverse that, figure out what the root cause is, and then have me show you how to reverse that. So the biggest thing that we need to wrap our minds around and really establish that proper mindset and manage those expectations is this is going to take time. This isn't something that we take medications for. This isn't something that we just get a massage and then boom, expect it to be gone. Or if you're familiar with physical therapy, manual therapy techniques like dry needling, scraping, taping, ultrasound, stuff like that. So it does help, and it's part of the equation for your treatment, or it can be. Everybody's different. Uh, but it's going to take time and it's going to take work. So that's the biggest thing that I want to convey. So this is the first part of my discussion. Let me know if you have any questions. I just wanted to introduce that I'm trying to start these discussions and kind of tell you a little bit who I am, what I do, and some of the big things in the dental field, which is pain. So let me know if you have any questions, comment below, direct message me. I'm here for you. Stick with me. I have 2 more sections coming. Can't wait to talk about those with you. See you next time.